Dear colleagues, in partnership with the Société Francophone de Nephrologie, Dialyse et Transplantation, the Österreichische Gesellschaft für Nephrologie and the Deutsche Gesellschaft für Nephrologie, Marcus at Home welcomes Professor Emmanuel Letavernier in Paris, France, and Professor Linda Shavit in Jerusalem, Israel, in order to discuss acute kidney injury after use of certain hair straightening products, which is a newly discovered disease entity. Dear Emmanuel, dear Linda, we're very happy to host you for the final stage of our Tour Académique, 2 days before the cyclists will arrive on the Avenue des Champs-Élysées. Great to have you.
Yeah, so dear colleagues, it's really a fascinating story we're going to talk about today. And I'm very happy to introduce our two speakers. So Professor Linda Shavit, you come from the Institute of Nephrology in Jerusalem. Linda Shavit is a very well-known expert on tubular interstitial nephropathies with a specific focus on the kidney disorders associated with malignant hemopathies and also on nephrocalcinosis and kidney stones. And of course, in this context, you were very interested by the topic we're going to talk about today, acute kidney injury with hair straightening products. And you published the first case series in the AGKD in 2023. And this is what you're going to talk about just after Emmanuel Letavernier, because we're in Paris today because of the Tour de France. So Emmanuel works in Tenon Hospital. He's a professor of nephrology with a specific interest on kidney stones, on hyperoxaluria, on oxalate nephropathy. And in this context, he worked with Thomas Robert from Marseille on the case that was published in the New England Journal of Medicine last year on the topic we're interested on today. And he did mechanistic insights in this topic. And this is what you're going to talk about just now, Emmanuel. It's up to you.
So thank you very much, Dominique and Gunnar, for your invitation. So I'm pleased to discuss about the pathophysiological implication regarding the development of oxalate nephropathy due to hair straightening procedure, and also raising question about the metabolism and the physiopathology of oxalate. So when we talk about oxalate, it's very small molecule because oxalic acid is the smallest decarboxylic acid, which is excreted in urine and considered as an end product. The problem with oxalate is that it binds with calcium, and the calcium oxalate crystals are the main cause of kidney stone formation. And patients who are affected by kidney stone are usually mild hyperoxaluria, and crystallization of calcium oxalate occurs in renal cavities or in the distal part of the tubules, and it's a very long-term chronic process, which usually does not lead to acute or chronic injury, except if stone pass and if there is an obstruction of the urinary tract. By contrast, the calcium oxalate nephropathy is observed in conditions where we have a massive hyperoxaluria, which leads to intratubular precipitation and may lead to acute or chronic kidney injury because of the precipitation of crystals in the tubules. You can see here a biopsy with the bright crystals observed when a biopsy performed. Of course, it's not always the case, and the calcium oxalate, monohydrate calcium oxalate crystals have a typical shape that can be of help to perform the diagnosis in patients. And today we will discuss about the causes of calcium oxalate nephropathy and especially toxic etiology. So I will discuss this just after, but we have to keep in mind that there are other causes of calcium oxalate nephropathy, which are relatively maybe not frequent, but not exceptional, which are due to malabsorption state, and which is called enteric hyperoxaluria, and which leads to an increased absorption of oxalate in the colon, and then expression of oxalate in the kidney, and it may lead to the formation of kidney stones, very recurrent kidney stone in patients affected by malabsorption, so patients who have short bowel syndrome, pancreatic disease. And this patient may also be affected by the nephropathy and impairment of kidney function. And primary hyperoxaluria is, of course, a family of rare disease, but with a very severe prognosis, leading to also precipitation of oxalate in the kidney tubules. Unfortunately, now we have some specific treatment. So I will not detail these conditions and focus on toxic injury. So toxic injury due to oxalate, it may be due to the oxalate itself. And for instance, It's probably rare in France, Germany, and Austria, but massive intakes of oxalate. For instance, here you have star fruit, which are very rich in oxalate, may lead to acute kidney injury. Of course, it's rare, but we can observe some cases sometimes, especially in patients coming from countries where star fruit is common. And maybe we have to be aware that also some mushrooms are supposed to contain high amounts of oxalate and lead to calcium oxalate nephropathies. And the chaga mushroom, which is called the mushroom of immortality, is probably very rich in oxalate. And there are some cases of patients who use this mushroom, which is supposed to be active against aging, of course, but against inflammation, against bacteria, against everything. And it may have very severe, lead to severe nephropathy. And another cause of calcium oxalate nephropathy is the massive intakes of vitamin C. It's been observed during the COVID period, the COVID era. Some people who thought they would be protected against COVID by taking a lot of vitamin C develop also acute kidney injury. So we can also observe this in some patients. But the most classic cause of calcium oxalate nephropathy is ethylene glycol intoxication, which ethylene glycol is present in antifreeze products. So patients who voluntarily or not have intakes of ethylene glycol may have calcium oxalate nephropathy, and the process is that ethylene glycol is transformed in the liver into glycolate or glycolic acid, and then this glycolate is transformed into glyoxylate, and glyoxylate is the last step preceding the formation of oxalate by the liver, and oxalate is then removed by the kidney. And patients who have intakes of ethylene glycol may develop these crystals which have a very specific shape, elongated shape, which is very suggestive for intoxication by ethylene glycol. So there are also other compounds that may lead to calcium oxalate nephropathy. I will not discuss further. For instance, hydroxycobalamin, but I will not detail this too much. So today we are interested by hair straightening products leading to calcium oxalate nephropathy. So I will not discuss too much these results obtained by the group of Professor Shavit, because I'm sure she will do it extensively, but this was the first extensive case study describing a high number of cases in Israel of patients who had calcium oxalate nephropathy. You see here the bright crystals made of calcium oxalate in kidney biopsies. And they observed this profile in many women. And the hypothesis at this time was that these calcium oxalate crystals would be a direct effect of their straightening products by two potential mechanisms. First, some of these products contain formaldehyde, which may be absorbed by skin and lead to tubular injury. And also, these products contain cosmetics, frequently contain glycolic acid. And this glycolic acid or glycolate is transformed into the liver in glyoxylate and then oxalate, and may lead to intratubular crystal formation. And this is a matter of concern because glycolic acid is present in many cosmetics. So if you look at home to your cosmetics, I'm sure you will find some cosmetics containing glycolic acid with various contents. And this is a typical French cosmetic. You see the name is Vino Perfect. It's supposed to be made with grape. And it's a pill mask. And usually pill products, pill cosmetics contain glycolic acid, and sometimes up to 40% of the cosmetic products is made of glycolic acid. So this is really a matter of concern if glycolic acid may lead to oxalate formation and precipitation in urine. And 2 years ago, my colleague, Dr. Thomas Robert in Marseille, saw a woman in consultation, so a young woman, 26 years old, and this woman experienced 3 episodes of acute kidney injury after hair straightening procedure. So that was an amazing observation because she repeated the process 3 times. So in 2020, she had the first episode. She went to the hairdresser. She then had nausea, vomiting, irritation of the scalp, and she went to hospital, and plasma creatinine was assessed and was around 200 micromole per liter. And then she recovered rapidly, relatively spontaneously, with only hydration. And she went back to the hairdresser next year, and she had the same episode, same acute kidney injury. And that's amazing because she went back again to the same hairdresser, and she had a new episode. At this time, Dr. Thomas called me to know what to do because he suspected at this time that it could be due to crystalline nephropathy, calcium oxalate nephropathy. This patient had no biopsy, no crystalluria. The papers from Professor Shavit was not published, so we were not aware that there are other cases, but he observed that the woman had relatively enlarged kidneys and a small stone. The stones passed spontaneously. And he collected the composition on the cream, the hair straightening cream product used by the hairdresser, and it appeared that it contained not glycolic acid, but glyoxylic acid. And glyoxylic acid or glyoxylate is the last step preceding the formation of oxalate in the liver. So we hypothesize that glyoxylic acid and also maybe glycolic acid could be both nephrotoxic, and we perform experimental studies in mice. So the challenge was to put the cream or the glycolic acid or glyoxylic acid on the skin of the mice, on the back of the mice, and avoid that the mice eat the cream. So we had to use anesthesia. And what we did is we used 4 groups of mice, 1 control group with only petroleum jelly on the back, and 3 other groups with either glycolic acid, glyoxylic acid, and the cream containing glyoxylic acid, the exact cream used by the patient, the woman in Marseille. And it's an experimental model. So we did 2 applications under anesthesia, removed the cream, and then we assessed the urine of the mice the few hours and 1 day later, and the animals were sacrificed the next day. And what we observed was an amazing number of crystals, calcium oxalate monohydrate crystals in the urine of the animals treated by either the cream and by the glyoxylic acid, only glyoxylic acid, with same concentration of glyoxylic acid than in the cream used by the patient. And you see that these crystals are relatively elongated and have the same shape as observed after ethylene glycol intoxication. And after exposure to glycolic acid, there were no crystals in urine. And we quantified plasma creatinine and urea to assess kidney function. And there was actually acute kidney injury in animals exposed to the cream, to glyoxylic acid. And this was the same for creatinine and urea. And histology reveals the presence of calcium oxalate monohydrate crystals after exposure to hair straightening. It was the same with glyoxylic acid. So you see these bright crystals stained in black with the Yasu staining. And we performed CT scans on the kidney of these animals. And as you can see, these are 2-dimensional representation of 3D reconstruction of the kidney, of the mice kidney. And you see that in controls or animals exposed to glycolic acid, the kidney are relatively normal. But what you see in red, it's artificially stained in red, these are the calcifications, the very dense deposits, which are observed after exposure to straitening cream and glyoxylic acid. And these dense deposits are calcium oxalate crystals, are calcification. You can see better in this 3-dimensional view. You see the tubules, if you look carefully, the tubules which contain the calcium oxalate. It boulders the tubule, and the kidney are full of calcium oxalate after exposure to the cream. And of course, we quantify the oxalate in urine, and animals exposed to either cream or glyoxylic acid have a very, very impressive amount of oxalate, around 4 millimole per liter. It's extremely high, much higher than in human patient affected by primary hyperoxaluria. So it explains why they develop rapidly acute kidney injury. But if you look carefully, what you can observe is that glycolic acid also induces a small increase, but significant increase. We are around 0.6 millimole per liter of oxalate. So 0.6 millimole per liter, it's not sufficient to induce oxalate nephropathy, but it's a significant increase. And what we observe also is that urine glycolate was increased after exposure to either glycolic acid or glyoxylic acid or the cream. So it means that glycolic acid may also pass through the scalp and be removed in the urine, and a small part of glycolic acid is transformed into oxalate. So that's of interest, I think. So how can we explain the nephrotoxicity of glyoxylic acid? So we have several hypotheses. The first hypothesis is that glyoxylic acid could pass more efficiently the skin than glycolic acid, but you see that glycolic acid also can pass through the skin, okay? The second hypothesis is that glyoxylic acid or glyoxylate is the very last step leading to oxalate synthesis in the liver. So maybe it may be an explanation, and maybe a part of the glycolate of glycolic acid may be removed by liver metabolism are not transformed into oxalates. That's another hypothesis. And the third, very interesting hypothesis at least, is that maybe that glyoxylic acid or glyoxylate may be transformed into oxalate by other organs, including the kidney itself. So maybe the high amount of glyoxylic acid or glyoxylate that may arrive directly to various organs, including kidney, may lead to a direct transformation to oxalate, because we need only one enzyme, which is LDH, lactate dehydrogenase, to produce oxalate from glyoxylic acid. So, to conclude, the straitening cosmetic containing glyoxylic acid induce calcium oxalate nephropathy. They should be banned of the market. So that's amazing, but these products are still used in France and many European countries. Although there are a lot of warnings regarding these products. And another open question is that what about the chronic use of cosmetics, pill, creams containing glycolic acid? Because even if the increase in oxalate is mild, maybe the daily use of this product may lead to a significant amount of oxalate, and maybe that a long-term use maybe would not lead to calcium oxalate nephropathy, but maybe a potential factor for development of kidney stones. So that's a totally open question. So I would like to thank Thomas Robert, who took care of the patient and warned us about the use of this straitening cream in Marseille, Elie Tang, who performed most of the experiments, and of course all the mice that suffered from straitening procedures. So thank you very much for your attention.
Thank you, Emmanuel. That was great. I love your mouse, your Brazilian mouse. So, of course, the questions will be at the end. And so now, Professor Shavit, it's your turn.
Thank you very much. So I will talk about our clinical experience in Israel, and I will start from 2019. The first patient came to our hospital in Shaare Zedek Medical Center in Jerusalem, and it was absolutely healthy 28-year-old woman. She presented to the emergency department with the profound weakness, nausea, vomiting, and abdominal pain. And we found that she had very high creatinine. Her creatinine was 7.4. And we know it that her creatinine was normal several months ago. We actually excluded all other causes of AKI. And on physical examination, she had no fever. She was hemodynamically stable. Nothing special in her urine, for example, no any electrolyte or liver function abnormalities was found. She had some mild metabolic acidosis, and we did full serological workup that was normal. And her ultrasound showed bilateral edematous in large kidneys. So we actually didn't know what happened with her, but after on a second or third hospitalization day, she, on a repeated anamnesis, she recalled to say us that actually she had hair straightening treatment several hours before the onset of abdominal pain. And she did it in professional hair straightening formaldehyde-free product in professional beauty salon. So it was a total surprise for us. At that time, we didn't know that there can be any connection between acute kidney injury and hair straightening products. And we looked at the literature, and we actually found two cases from Egypt, published exactly on 2019, at the same year that this patient came. And they presented very similar clinical picture of abdominal pain and vomiting and nausea, very severe acute kidney injury requiring hemodialysis in both patients. And they did kidney biopsies. And at kidney biopsies, they saw ATM and acute interstitial nephritis. And they actually didn't know what's the cause of this injury, acute kidney injury, and they thought that it may be formaldehyde. Okay, what happened over the next 2 years, we had additional cases of young, healthy females presented in Israel with severe acute kidney injury after hair straightening. And then we decided to look after these patients and to see what happens. So in order to identify these cases, we actually contacted all nephrology departments in Israel. Israel is a very small country, and so we were able to contact all nephrology departments, and we defined acute kidney injury as probably related to hair straightening if it appears during 48 to 72 hours after the hair straightening. Other etiologies for AKI were excluded, and the patients had symptoms and signs of systemic toxicity like abdominal pain, vomiting, and scalp irritation or eruption. So over 2 years, we identified 26 cases in 14 nephrology departments in Israel. And here you can see the baseline demographic and clinical characteristics. Age of 28, all were female, all were healthy, absolutely healthy. 3 had a history of nephrolithiasis, and 3 had a history of psoriasis, of skin disorders. Otherwise, the clinical symptoms were very similar. Most of our patients had nausea, vomiting, and abdominal pain. About 40% had scalp rash and eruption. What was interesting is that we know the hair straightening product in 10 cases, and we know that in all 10 cases, it contained glyoxylic acid, not glycolic acid, but glyoxylic acid. In other 16 cases, the product was not known. So all our patients denied any exposure to chronic medication, herbal products, over-the-counter supplements. They didn't have any abnormal dietary consumptions. 3 patients reported they took some tablets of NSAIDs after onset of abdominal pain, and also PPIs after abdominal and flank pain. And 2 patients, very interesting, reported recurrent episode of acute kidney injury following hair straightening. So they had 2 recurrent episodes after 2 procedures of hair straightening treatment, like your patient in France. Yes, it was 3 episodes. We had 2 patients with recurrent episodes. Okay, and here is the lab data. Nothing very special. Calcium, phosphor, magnesium, all this was normal. Creatinine was very high. Peak creatinine was 5.4. No any liver function abnormalities, and also the findings in urine was unremarkable. We didn't see calcium monohydrate crystal, calcium oxalate crystals in urine. And we did kidney biopsies. We did kidney biopsies in 7 patients. And actually, the glomeruli were normal in all our patients. All our patients had acute tubular necrosis and acute interstitial infiltration. And what was very striking finding was a massive deposition of calcium oxalate in tubular cells and also in interstitium. And the crystal to glomeruli ratio was very high. You can see in some kidney biopsies, you can see some calcium oxalate crystals, but not such a massive amount. And when the crystal glomerular ratio is very high, it's more than 0.5, it's thought to be a causal effect of calcium oxalate nephropathy for acute kidney injury. And in our patients, the ratio was very high, even 8, 3, and very abundant and massive deposition of calcium oxalate. And this is the picture of kidney biopsies. You can see here in kidney tissue the calcium oxalate crystals, and also secondary acute tubular necrosis and acute interstitial infiltration. So clinical cause of our patients all received IV fluids. 5 received steroids because of the acute interstitial nephritis. 3 of our patients required hemodialysis, 3 to 5 sessions, all recovered. In all patients, kidney function improved during the hospital stay, and we had a follow-up after 2 months. All patients' creatinine returned to normal range. So we analyzed marketing hair straightening products, and we found glyoxylic acid, not glycolic acid, in varying concentration between 0.5 to 26%. And the pH of products in some products was very low, less than 1. The concentration of formaldehyde was very low in most of our products. We found less than 200 ppm, and we didn't find any ethylene glycol or in the hair straightening products. So you already talked about the pathophysiology, and I'm not going to return about it, but we definitely think that there is a skin absorption of glyoxylic acid and then deposition in the tubules and interstitium, and we don't think that there is a significant role of formaldehyde because it was very low concentration of formaldehyde in our product. And after your experiment, of course, the causality is highly probable. The role of glyoxylic acid in triggering acute kidney injury is highly probable. So we published our article in 2023 in AJKD. It was a real national effort in Israel because many nephrology departments collaborated to publish these cases, and we thank all our colleagues for that. In 2023, Israel Ministry of Health banned the hair straightening products containing glyoxylic acid because of risk of severe kidney injury. And what happens after this? 2023, we have additional a year and a half. So in Israel, during the last 18 months, additional 14 new cases were reported. This is not published. The age of patients is between 15 to 33 years. All patients, female and all healthy. No kidney biopsy was performed in these cases. We know it products in 5 cases, and in 5 cases the products had glyoxylic acid content up to 25%, very high percent, and the acidic pH is less than 1. So by now, as much as we know, overall 46 cases are reported in the world. 40 of them are from Israel. And that's the end of my presentation.
Thank you very much. This was a fantastic story. I think it's a remarkable example of how doing a careful clinical workup can lead you to a hypothesis, to ask your colleagues if they have similar cases. And as you did in Israel, and as Emmanuel and Thomas did in France, get to build a very solid hypothesis, demonstrate how pathophysiology can demonstrate causality of the drug, and in the end, try to ban this from the market. So this would be my first question. You just showed us that in Israel this had been validated to ban the product from the market, but I know, Emmanuel, you also had quite a large coverage in the media, and you contacted the French health authorities. So how did this work? And the second part of the question is, okay, so this is in Israel and in France, but of course this product is probably not limited to these 2 countries. How is it distributed in the world, and what's happening elsewhere regarding this potential market ban?
Yeah, it's a problem, I think, in Europe, because we warned the national authorities in France, and there was a warning in the media and important media coverage, but it has been said that the product should be banned at the European level. Okay, so it means that the French authorities decided not to ban the product and to ask that the product should be banned at the European level. So it's still authorized now. So that's amazing because it's highly toxic. There is absolutely no benefit for us. Of course, cosmetic is important, but risk-benefit ratio is clearly not good. And that's amazing because there are many drugs that are withdrawn on ban of the market if there are some side effects. And in this case, there are only side effects and no benefit for us, and it's still authorized. So really, I do not understand. So should we wait for very severe cases and women who will not recover kidney function after acute kidney injury? So I think it makes no sense. And regarding just a remark regarding the number of cases, in France, there are also other cases, not unpublished cases, of course. And we collected the data related to a significant number of cases. And I know from colleagues from Tunisia, for instance, that there are some countries where many women are affected by acute kidney injury following straitening procedures. So, of course, it's not published, but it's a worldwide problem.
Might I just add 2 questions here? So the first would go to Emmanuel. Are you aware that in Brussels at the EU level, there's some discussion, or is this not really a topic for the time being? And the question to Linda would be, so these cases you reported that occurred between 22 and 24, these occurred before the ban went into action. Did I get it right?
Yeah, we have before 26 cases before and additional 14 cases after the product was banned. But we understand that the patient can buy the product even through internet. They can do hair straightening at home, or by today in Israel also hairdressers, and also of course nephrologists. The first question they ask young women presenting with acute kidney injuries if she had hair straightening recently. So I think that's why we have so many cases, because the awareness of our doctors is very high. But we still continue to have these cases. We still continue, after banning the product, we still continue to have these cases. Maybe not so much as it was before, but still we have. And also the very, a problematic question. In Israel, hair straightening is very popular. We have girls that started hair straightening at the age of 14, 13, and the alternative product for hair straightening was not found, and also maybe acetic acid or other acids that are not so dangerous for kidney can be used. So this is the main problem. People are looking for hair straightening products. It's very popular, and I don't think we can, control each product on the market, even after banning.
And Emmanuel, any European efforts for the time being that you are aware of?
I'm not aware of. I don't know. I really don't know. I think it's in process. It's in progress, but I don't know. I really don't know. I have no news.
So how could it go forward? Should it be the national or the international societies of nephrology that go to see the people in Brussels? Because this is potentially a very important issue. I mean, probably people who use these products and who have a medical background are a bit worried listening to this, and I would honestly think that it deserves to go much further. But of course, it cannot rely only on you two.
Yes, you're right, Dominique. Maybe national societies, nephrology societies, would send a warning to the health authorities. Yes, I think because I think at the national level the product should be banned. We should not wait for European banning.
And when you were talking about the possibility that it may have chronic implications, either the repeated AKI with the glyoxylic acid or maybe the glycolic acid itself on the long term. My question is, how old are these products? How long have they been on the market? And how could we retrospectively think that some cases of AKI or of nephrocalcinosis, I don't know, could be potentially explained by this, which was absolutely not known until you both published this?
I absolutely agree with you because, you know, I think we have this product in Israel in about 7 to 8 years, in the use. And I think that what we see here, it can be just a, you know, peak of the iceberg, because we just identified very severe cases that presented with severe general intoxication, with all this abdominal pain and vomiting and scalp irritation. And maybe there are many cases that just going undiagnosed with a less severe acute kidney injury or less severe intoxication. And maybe when you use it, in Israel, we have women who use it every 6 months for years. So it can be, maybe, I don't know, it can be a cause of one of these unknown causes of CKD that we have a lot of is as cause of CKD or even end-stage kidney disease. So yeah, we just don't know. We don't check every woman after her straightening to check what happened with this creatinine, with the creatinine level.
Yes, I totally agree, because I think the product has been used relatively recently. I mean glyoxylic acid, because it was patented around 10 years ago, and the objective was to replace the formaldehyde, which is very irritative and toxic also. And it was planned that glyoxylic acid would be very safe, and some of the products used are organic, and so it's really supposed to be good for us. Of course, it's not, and it started a few years ago only. And we know that one episode of acute kidney injury is a first hit that may expose to further an increased risk to develop CKD. So probably that there are many women who have repeated kidney injury, and some of them will be next affected by hypertension, diabetes. Probably we may hypothesize that it will increase their risk to develop CKD. That's the first thing. And regarding glycolic acid, even if there is no risk, no evidence for acute kidney injury, to my knowledge, there is only one case of exposure to glycolic acid in a renal transplant patient who had acute kidney injury, but massive exposure. Really, when we see the increase in urine oxalate in mice model, I think we should look if it may have an effect. It may lead to an increased risk to form kidney stone. Not calcium oxalate nephropathy, but maybe kidney stones, because the amount of glycolic acid, glycolic, not glyoxylic, in cosmetic products, sometimes it's up to 40%. The product we use in mice contain 10% glycolic acid with a short time exposure, and it was sufficient to increase urine oxalate significantly. So 40% exposure, repeated exposure with product containing 40% glycolic acid, I don't think it will impair kidney function, but maybe it's a risk factor for kidney stone. So I think it's an open question.
Emmanuel, I have a question for you. If tomorrow in Tenon Hospital you have a young woman who is in the department for exactly this problem, will you just do a conservative management, or will you use a therapeutic strategy? You worked on stereopental and other forms of oxalate nephropathy. Could it be an option, or is it too late to do that?
Until now, I think, to my knowledge again, but I'm not sure, maybe Professor Shavit will have other information. There is a relatively rapid recovery of kidney function. Of course, rapid recovery of plasma creatinine. We don't know what happens in the kidney tissue and if it exposed to further fibrosis and chronic kidney disease. But usually the recovery was relatively rapid. So I think regarding stiripentol, it may be too late, because if exposure occurred hours or even days before, I think maybe it would be too late. We have no data regarding this. So I cannot address this question, but probably too late. So I think conservative treatment seems to be a good option, of course. But you said, Dominique, if we have in our unit in this case, but maybe more, 6 months ago, we had one case in the nephrology unit, and it took 3 days to make the diagnosis. Because even when doctors are aware that it exists, and it was only because a young doctor was aware of this risk, asked to the patient 3 days after the hospitalization if she used her straitening products. She said yes, and she had calcium oxalate crystals in urine, and she had a calcium oxalate nephropathy due to her straitening. And so even in centers, in units where doctors are aware that it exists, it may be difficult to make the diagnosis. So imagine the number of cases you have that are not diagnosed.
This is certainly one of the benefits of this webinar. It's that many more people will be aware of this, and maybe it could help, of course. I just have one last question, which is these patients, do you think they may have specific predispositions, specific factors that will make them have a more severe disease or not? Because when you see that also the mice, the black cyst mice, do the same thing, my first hypothesis would be there's no genetic predisposition or tubular interstitial predisposition for this. But do you think this may not be the case, and something happens in some patients and not in others?
So we don't have the answer to this question. In our case series, about 10% of patients had kidney stones. And you know, it's not a regular age or usual age for kidney stone disease in females. Females about 20 to 30 years old. So we thought about some genetic predisposition, and we think to do some whole exome analysis in the future on this patient. And then I know that in your case, in the French case, you did whole exome analysis and didn't found any primary hyperoxaluria. But also the brother of your patient had severe kidney stone disease.
There's a brother, yes, but it's a very frequent disease, kidney stone. So maybe that's an interesting question. We don't know to date, but maybe, of course, patients who also have hypercalciuria and some predisposition to, or patients who do not drink enough water. Of course, maybe these are risk factors, but we really don't know. But we don't know. I'm not sure that it's necessary to explain the phenotype, because it's a so huge amount of oxalate that is delivered to the kidney in the mouse model, probably in women too. That not sure we need to have a genetic defect. But of course, if there are thousands of people exposed to the products and only a minority has acute kidney injury, maybe there are some additional risk factors.
I have 2 or 3 final academic questions for this year's Tour Academic. And the first again goes to Emmanuel. So you told us, and you also wrote in your articles, that these products have been patented. And if I remember correctly, by a very famous French company, actually. But many other companies actually also sell products which contain these compounds. It's not limited to one company. Did I get that right?
Yes, that's right. It's been patented by a famous company, but I think the patent was not maintained, was not. So I think it's open, and I think many companies can use it for free. And so I think the patent was not developed further by the company. That's my hypothesis, because I don't think that this company is interested. Now they are no more interested, of course. But yes, it's been patented, but I think there is no more efficient patent. Yes.
And I'm absolutely no expert in hair straightening, and I have few hair remaining and never did that. But how did you choose the amount of the compound that you applied to your mice? Because I guess it's quite difficult really to find the right amount. And you also wrote that you did some skin massage in order to really have enough contact with these compounds, whereas actually people who receive these compounds should not have straight contact with a scalp, but it happens actually time and again, if I got it right. And then again, if you apply these in patients who go to their hairdressers, they also need some heating, I guess, during this procedure, don't they?
Yes. So it was an experimental model. So we wanted to show if there is an effect in a very short time. So of course it's a very severe model because we did 2 applications, not 1, but for only a limited time. So the woman can keep the products for a very prolonged time. So, and the question of the contact with scalp is very important, of course. It's said that in theory, because it may promote irritation of the scalp, that the product should be exposed, the hairs should be exposed, but not the scalp itself. Of course, you can imagine it's very difficult, okay? And the woman ask also on use that the product is exposed to all hair, including and reach the scalp, because they want to have very straight hairs. And so they use by themselves, or they ask to the hairdresser to use to apply the product to the whole part of the hair, including scalp. So it may explain why there is a passage. We cannot avoid this. I think it makes no sense. I think the product is in contact with the skin. So of course, the experimental product was designed to be relatively severe and to obtain significant results in a short time, of course, but it was very, very severe. So, and we also performed unpublished experiments with only 1 application, short-time application. It was still very toxic. And the
But you did not do any heating during this procedure
no
with the
heating,
animals?
no heating.
Yeah.
The massage only.
And my last question
Okay.
to Linda. So you reported that many of your patients had vomiting, abdominal pain quite early, actually, during the procedure. So this might not be the symptoms of acute injury, but this rather sounds like some symptoms by the procedure itself.
So it's very interesting question, and we actually don't have answer to this question. We don't know why this starts with GI toxic side effects, but it was the main complaint of our patient. 80% of our patient had abdominal pain, vomiting, and nausea, and only 45% had some scalp irritation or scalp erosions. So I don't know how to explain this toxic effect. I don't think it's acute kidney injury. Also, although the acute kidney injury appears very quickly in our patients, it's about 48 hours to increase creatinine from normal to 7.4. So that was our first case. And our additional cases also had very high creatinine, so the process was very quick. And in some patients, we also checked oxalic acid in the blood, levels of oxalate in the blood, and it was normal. And we think that all this just went to the kidney tissue, and that's why it was normal. So all this, we tried to do hemodialysis in the beginning to remove oxalate from the blood, and then we understood that it's not so efficient because they don't have oxalate in the blood. So I don't know why GI side effects, I have no idea, but I know that the acute kidney injury is extremely quick. It's extremely quick. It's 48 hours in average, from normal to very severe acute kidney injury.
So thank you very much to both of you. This was really a fascinating story. You are aware that this is the Tour Académique, which is based on the Tour de France. And now we are at the last stage. And ici c'est Paris, as people say in Qatar now. So, Emmanuel, you are going to share a few slides from Paris for people who, of course, do not know this city, and you're going to tell us what's fantastic here.
Yes, thank you, Dominique. So, ici c'est Paris, but I will not talk about football because I know that you support the Olympique de Marseille. So, it may be difficult for you, and also by respect for Dr. Thomas Aubert in Marseille. So, I will not add too much pain. So, what can you do in Paris? So, if you come this summer or in the next months, so first reopening of Notre Dame Cathedral, of course, after the terrible fire 5 or 6 years ago. So first thing, but you have to book very early the visit because there are many people. It's very crowded now. So first thing you can do, but also you can see the Olympic balloon, which will return every summer up to the Los Angeles Olympic Games. So you can admire it and show it every night during summer. So if you go and you visit Paris by night, it will be beautiful. And last, for the first time, now the Seine River is clean. And this summer, you can swim on the Seine. There are 3 sites that will open during summer. And it costed 1 billion euros to make the Seine River clean again. So it's supposed to be clean. So if you are very brave, you can share the Seine with many little friends. So enjoy Paris if you visit in the next months. Thank you.
Thank you very much, Emmanuel. And of course, all of you know Paris and many beautiful things to do. And this year, I think the first time the Tour de France will go along the Butte Montmartre, not only in the Champs-Élysées. And this will be something very nice to follow. Well, thank you to both of you. This was a great last session of the Tour Académique, and maybe see you next year, folks.